Dr. Allan Caudill is a Bronson general surgeon and medical director of the Wound Center at Bronson, South Haven. And he's on the phone with our monthly check-in. Wound Care Awareness Week was last week, Doctor. Why the focus on chronic wounds? Are not healing wounds really a big problem?
They really are. If you look at 6.7 million Americans are living with chronic wounds, and that number is increasing rapidly due to the aging population and the diabetes epidemic. So it really is a problem. It's the 1 in 4 families have at least one member with a chronic wound in their family.
What do you folks consider a chronic wound?
Most wounds heal normally in a stepwise fashion. We identify 4 steps that they go through. The body, amazingly, is very complex, and it has the ability to heal most wounds. But in some people, that process becomes stuck, or what we call stalled, in one of the steps and fails to progress to normal healing. We usually define a chronic wound as one that fails to heal within 30 days is the definition that we use.
So what causes them? Who gets chronic wounds?
Basically, most common wounds appear in people with diabetes or blood vessel or vascular disease. Basically, those individuals have decreased immune system response. The diabetes can cause that. It also affects blood vessels. People with blood vessel disease have difficulty delivering oxygen, and oxygen is very essential in the process of healing. The body uses it in many ways to heal wounds. So if oxygen delivery is diminished, then the risk of wounds go up. And also people in diabetes have what's called neuropathy, as many are aware. And what neuropathy means is it's a lack of a pain response. And a pain response is very essential for the body to protect itself. Those of us that don't have neuropathy don't appreciate it as much as those that do, because if you don't have the proper response to pain, then you can get pressure points that can cause injury to the skin and then develop a chronic wound and not even be aware of what's going on.
So what happens if chronic wounds go untreated?
If chronic wounds go untreated, the risk of infection of a chronic wound that's there for 30 days increases 50%, and wounds that remain open, the risk of amputation becomes much higher the longer that wound is available. The numbers show that the 5-year mortality or risk of death following an amputation approaches 50%. 50% will develop an ulcer in the opposite extremity within 5 years. And one amazing statistic that I wish was more available to people is the risk of death following an amputation is 50% within 5 years. That risk exceeds the mortality from most forms of cancer. Cancer gets a lot of press and exposure, which I think is appropriate, but we also need to realize that the risk of chronic wounds leading to amputation is higher than most forms of cancer. Wound prevention, very important. Stop smoking, do frequent foot checks, proper footwear, especially in diabetics with neuropathy. The cost of wound care, chronic wound care, at this point they estimate $50 billion. I think that's underestimated, and it's increasing rapidly. So $50 billion at least nationwide for treating chronic wounds.
So if someone has a wound that isn't healing, what can your center do for them?
That's the exciting part. I've been doing this for several years, and I learn something every week. What we do is we specialize wound care, and one other exciting thing across the medical field is that people are seeing that wound care is a specialty unto its own. It's very complex, but also there are simple things that we can do to help people. And the first thing we do is we treat the whole patient. We look at the patient and see why did they get this chronic wound, try and determine the cause, and it can be multiple reasons, and we figure out a way to treat that cause, optimize their diabetes. We work with their physicians quite closely to do that. Also, if they have blood vessel disease, there's testing we can do to determine the severity of that. We work closely with vascular specialists. They've been very helpful to work with us to optimize the oxygen delivery to the wound, which is very, very important. We work with their primary physician to optimize the wound healing environment. We also have many specialty products that we can utilize to aid healing. The science of wound healing is just growing astronomically. Finding what causes these wounds to not heal, it's a fascinating field. And they're also coming up with multiple products that we can use to individualize with to wounds to increase the chance of healing, decrease the risk of infection. In patients with neuropathy, wounds caused by pressure, by non-sensation, we have special ways to offload. We can place them in casts. We work with the prosthetic providers to get special footwear or boots, working with their primary provider to help decrease the pressure to get that wound to heal. And one fascinating thing, which I have become very impressed with, is we have the hyperbaric oxygen treatment, or basically a way to place patients in a pressurized oxygen environment. Really aids healing. The statistics are very impressive relative to what that can do to speed the healing. So we use that. We have chambers we can put people in. We treat a lot of patients, and the results are good. So what we do, we individualize treatment. It's a specialty field. We have protocols we follow to optimize their care. So we can do a lot, and basically what we find is we are able to heal the vast majority of all wounds that come to our clinic. So it's exciting, and it's just at times we are brought to tears with what we can accomplish along with their physicians and the patient's cooperation. It can be very rewarding.
Do they need a referral from their regular doctor to see you?
No, they do not. We do encourage them to work closely with their primary providers. That's so important. Get foot checked. And if a patient, especially diabetics, if they need to check their feet frequently, if they notice a dark spot, a large callus, especially any draining areas, they need to be checked immediately because those can progress quickly. They need to let their primary provider know if there's a problem. They need to make sure that they get their feet checked with every visit. But no, they do not. They can call us directly at 639-2976, and we can answer any questions and get them in. Glad to help, and I will beat our drum a little more. I probably did on the last one, but the Bronson South Haven Clinic was chosen by Hologics, who is the corporation that we work with, as one of their top 5% clinics internationally out of 800 last year. So we are getting good results and being recognized for that. But they can call, work through their primary provider. They do not need a referral to see us here in the clinic. Just give us a call, and we will answer all their questions.
You mentioned the South Haven Wound Care Center, but they're also in Battle Creek, Kalamazoo, and Paw Paw?
Correct. Bronson has 4 systems throughout their system. If they are in those areas and that's more convenient, they can contact those wound centers. They can also get on the Bronson website at bronsonhealth.com/wound, and there is a myriad of information there about availability of treatment, or they can call the hospital directly and ask for the wound center.
Thanks, Dr. Allan Caudill, Bronson General Surgeon and Medical Director of the Wound Center at Bronson, South Haven.